Welcome, and thank you for choosing Western New York BloodCare for managing and treating your bleeding, clotting-related medical needs. Before starting the infusion process, be sure to choose a comfortable, clean, and well-lit area for the patient. It is important to wash your hands thoroughly and to wear gloves if you are a healthcare professional. Gather all the necessary supplies for the infusion and lay them out onto a Chuck's pad. Confirm the dose on the product box is correct and is the same as the prescription from the doctor. Open the product box, remove the contents, and lay them out onto your work area. Tightly screw the attachment onto the saline syringe. Remove the cap from the product. It is very important not to touch the rim of the vial once the cap has been removed. Remove the cap from the transfer device and place it on top of the product vial by pushing down firmly. Remove the plastic covering from the transfer device. Remove the cap from the saline syringe by pushing away from you. Turn the syringe upside down and screw onto the transfer device. Gently push down on the plunger. Unscrew the syringe from the product vial. Place the product vial between your hands and gently rotate the vial until the solution is clear and all the product has been dissolved. Never shake the product. If the prescription includes multiple vials, repeat the reconstitution process. Some products have different transfer devices. Refer to your product's insert for specific instructions. Remove the syringe from its packaging, avoiding contact with the tip. Screw the syringe onto the product vial. Turn it upside down and slowly pull back the plunger until all of the product is inside the syringe. Unscrew the syringe from the vial and place it onto the Chuck's pad. Remove the butterfly wing set needle from its packaging. Screw the butterfly tubing onto the syringe. Gently compress the plunger until the product reaches the tip of the needle. Apply a tourniquet around the patient's bicep. It can be done over a sleeve for comfort. Locate a vein in the arm that can be seen and felt. Using ChloraPrep, clean around the injection site and wait for the area to dry. Remove the cap from the needle and, holding the needle bevel end up, pinch the wings together. Insert needle into the vein, entering at roughly a 45-degree angle. It is normal for a flash or blood return to occur. Release the tourniquet. Gently push on the plunger, administering the product slowly over a 2-minute period, periodically checking for a blood return. Should the patient experience pain or extreme discomfort, it means the needle has not entered the vein and should be removed and reinserted into another vein. When all of the product has been administered, place a gauze on the injection site, applying gentle pressure. Slowly remove the needle while continuing to apply pressure. Activate the needle safety device, pressing until you hear a click. Apply Coban wrap around the injection site. The wrap should remain in place for 1 hour. Monitor the patient for an allergic reaction. It is recommended to have Benadryl on hand should a reaction occur. With the needle safety device activated, discard the needle into a sharps container. Discard all other materials. Remove gloves and thoroughly wash hands. You can always refer to the instructions included with the product or contact Western New York BloodCare with any questions.